Very good. Okay.
Dr. Rinaldi, back with Dr. Rinaldi, a podiatrist in Brooklyn. Dr. Rinaldi, tell us specifically about how to maybe prevent or what to do if you have an ingrown toenail. And also tell us a little bit of, rather than it is probably uncomfortable, maybe unsightly, what else, if it's not fixed, such an ingrown toenail, what havoc can it cause in the body?
The interesting thing about an ingrown toenail is the improper treatment that a patient will try to accomplish prior to seeing the podiatrist. I received an emergency call last night, for example, with a patient that wanted to come right in. We accommodated the patient, but as soon as the patient came in, we saw that the patient had applied a very heavy ointment to the toe. Most patients think that applying an antibiotic ointment to an infected toenail is a good thing. It probably is a bad thing, because what happens, the ointments, the creams, etc., tend to act as almost like a salve which compresses the infection inside as opposed to allowing it to come out. Cardinal rule with an infected toenail, especially if they cannot get to the podiatrist that evening, is to use some form of a soak. We use tea tree soaks in our practice, but regular saline, salt and water soaks on an immediate basis is a very good thing. It decreases the inflammation and promotes drainage. When the patient obviously comes into the practice, we'll do what is appropriate to release that infection by removing more than likely a portion of the nail. Most times the entire nail does not have to be removed. Once the infection subsides, then the patient is out of danger. Yeah, I believe your question comprised also what would happen if it were not treated. Well, if it were not treated, then we have these wonderful conditions called cellulitic changes that could take place, where the patient can develop a red, yellowish streaking up the leg, and then it could become a very onerous problem, which may require systemic antibiotics. In our practice, if the patient does come in with a problem like that, the nail is not even touched at that level, and they undergo a general systemic antibiotic program or an oral antibiotic program, and then the patient is brought back and the nail is corrected. To take that a little further, sometimes the nail is infected because it's fungused. It's thick, coccyx, which is a podiatry term for a thick nail, and it's the thickness which makes the nail grow in. If that's the case, then naturally one of our treatments has to be directed to not only remove the portion of the nail that's involved, but to change the environment of that nail. That's where laser treatments come in today, where a specific laser is used. In our practice, we use something called a K laser, which penetrates right through the nail plate to the nail cells and can actually change the nail plate by saturating it with oxygen and killing the fungus.
Okay.
Pretty much.
So tell me. So obviously, yes. So basically, it's an infection which can go into the body, and then all kinds of things can happen, and you need to have major treatments, which is not good. When you have an infection, don't best just wash it off, soap, salt water, go to the doctor as fast as possible so he can then do what needs to be done and take out the infection in some type of surgical way, whatever that might be. Now, what about, I'm sure a toe doesn't just get infected. It's not like hitting your head on a wall from 1 second to another one. How does that build up, and what can a patient do? You keep hearing cut your nails straight and blah blah blah. But is there something in terms of shoes? Is there some mistakes people make which kind of makes it easier to get such an ingrown toenail?
An ingrown toenail in and of itself is usually associated with a deformity in the toe. most of your nails that you look at, other than those that are fungused or thick or ingrown because of that thickness, are created because the toe, and let's refer to the big toe because that's usually, I would say probably 70% of the time where it does occur. Usually that big toe has a deviation to it. By that I mean the toe is not straight. There may be a bunion associated with that toe. There may be an underlying overgrowth of bone under the toenail itself. And that's pretty much the essence of how it began initially. Then you've got the components of very tight shoe gear, tight hose, maybe doing an activity longer than you should. I know the term turf toe is very common, especially in today's day and age, as we're all involved with some form of activity. This can occur by your toe hitting the shoebox, even though it may be a good shoebox, it may be a sneaker, but yet that activity pushes the toe forward, and that all perpetuates this ingrown nail. It is something that doesn't occur overnight, however. It is usually something the patient individual tends to tolerate for a little period of time, and then it begins to fester, and that's when they seek help, either self-help or hopefully the help of a podiatrist.
Okay, all right. So the activities have a lot to do with it, and
the activities and especially the deformity, the shape of that toe to begin with.
And that shape of the toe has very often to do with shoes. I mean, I, for instance,
the shape of the toe. Right, the shape of the toe has nothing to do with shoe. The shape of the toe probably has more to do with their mom and dad and grandma and grandpa than it has to do with the shoe gear. That whole mystique of shoe gear creating a problem is a mystique. Shoes do not create problems. You can take an individual. I specifically think of the female population who wear the craziest of designs, and I never tell them not to because it doesn't work, but they'll wear the craziest designs and have not one problem with their foot. But you'll take another individual who wear the same shoe and it'll be a problem. It's the foot that's the problem. The shoe will aggravate it, but it's the foot that's the problem.
So there's it's kind of like almost inherited or whatever. It's a certain growth, and yes, then if you do certain things, you might accelerate it. But it's just watch it, I guess. Watch it, and if things are happening, if you go early enough to a podiatrist, you guys might be, because you might go and say, look, this is too thick of a toenail, so we're going to make it thinner. We're going to do what we have to do, and by doing so, you'll never reach that end state of having this huge inflamed toe and hurting.
Yes, there is prevention if you catch it early enough. That is correct, yes.
Good. Well, wonderful. Again, thanks for your candidness. It's nice to know that actually the shoes don't play so much of a role. I myself like to wear smaller shoes. I think I look awful ugly if I put those big things on it. So, I rather have a half a size smaller than bigger. And, I do not have any ingrown toenail, at least not as of now. And so you just confirmed that basically wearing relatively tight and small shoes, doesn't seem to be it. Thanks a lot, Dr. Rinaldi.
You're so welcome. Have a great day. Bye-bye.